Good afternoon, ladies and gentlemen. I am Tanya Lobestall. I'm the Acting Public Affairs Officer, and I want to thank you all for joining us today. We are here to provide information on the progress the Phoenix VA healthcare system has made in response to the Inspector General review. The Phoenix VA Interim Director will provide a brief statement and will then take questions for a short period. We ask that you contain your questions to the Phoenix VA healthcare system. And at this time, it is my pleasure to introduce to you the Phoenix VA Interim Director, Mr. Glenn Costie.
Hello everybody, my name is Glenn Costie and I am normally the director of the Dayton, Ohio VA Medical Center, and I've been assigned here to be the interim Medical Center Director until November 6th. So I have a prepared remark I would like to give you, and then I'll be open for some questions. The Phoenix VA healthcare system and the Department of Veterans Affairs respects the independent review and the recommendations of the Office of the Inspector General regarding issues with patient scheduling and access. We concur with the recommendations in the final report and have developed and implemented an action plan to address the issues identified by the Office of Inspector General. I'm pleased to announce that of the 13 recommendations specific to the Phoenix VA healthcare system made by the Office of Inspector General, 10 have been addressed, and we will be submitting our progress for review by the OIG. We are also making significant progress on the other 3 recommendations as reflected in the Office of Inspector General's report. Our deepest apologies go to the veterans who've experienced delays in receiving care here at the Phoenix VA, and we hope these improvements will serve to restore your trust and the trust of veterans across our community and in our medical center. We know, however, that actions speak louder than words, so I want to take a few moments to update you on specific steps we've taken to improve your VA. We have drastically accelerated our hiring process. We've added more than 250 staff since the beginning of the year and more than 100 in the past 3 months. We also have in process bringing on an additional 200 staff in the very near future. All of our schedulers have been trained and are properly using the electronic wait list and the near list. We've begun our cultural transformation. This includes focusing on psychological safety for our employees, and all of our leadership has completed whistleblower training. We've developed a $280 million capital improvement plan that includes a 300,000 square foot ambulatory care addition. I want to thank the dedicated staff and the talented healthcare professionals who've chosen to serve our nation's heroes here at the Phoenix VA. Your devotion to the mission of caring for those who have borne the battle and your hard work is truly making our VA a top-notch medical facility. As has been reported numerous times in the media, our patients are very satisfied with the quality and safety of their health care. Our goal is to deliver the right care for the right veteran at the right time every time. By working together with our veterans and stakeholders and our community partners, the Phoenix VA healthcare system will become the provider of choice for veterans health care here in the Valley. And we thank all of our veterans for their service, and we will look forward to serving them every day here at the VA. I'll now take some questions. Yes, ma'am. Any of our veterans and their families that are concerned about the care for our veterans, we meet with them and review with them the care that they received. I can't really speak to any specific families that we've spoken to so far, but anybody that has come with us that is concerned about the care, we meet with them. I met this week with a mother of a veteran and just updated her on what we're doing for his care. No, we have not met with any of them, no. Yes, ma'am. You know, that's a question for our national leadership. The hiring and personnel actions of all medical center directors are managed by our central office, and you would need to refer that question to our executive leadership in central office in Washington, D.C.
In your experience with the Veterans Administration, how would you characterize the speed with which these changes are being implemented?
You know, I've been through several events in my career. I was at the Cleveland VA during the primetime issues back in the 90s. I've been at the Dayton VA right after some of the issues with dental care. I would say these are historic times. The support that we've gotten here at this site is unprecedented. We have staff from all over the country, either here working with us or virtually through our computer systems, helping us remotely, and it is unprecedented. The improvements in our staffing process, where we brought on so many staff so quickly, is a direct result of that kind of collaboration that's happening around the country, and we're very happy to have that support. I always say that out of a negative comes a positive, and I think we're really seeing the right sizing of the Phoenix VA for the veterans in this area. Clearly, we were understaffed and under-resourced for many years, and I'm glad to see that we're starting to get that resolved. I'm not aware of any of their actions, with the status of their actions. I just read what's in the newspaper about the status of those individuals. Right. So those individuals were reported to us by the IG, and we will be following our quality improvement program that we have here at the VA. Basically, we will be doing a very complete and independent review of their care, and if any of those family members have a concern about care, we will reach out to them, hold a meeting with them, explain the care, and talk about what we can do in the future to improve care for other veterans. They're in the report. They're in the report. We will probably try and get those from the IG. I don't know. I'm assuming they have the identity. They refer to them by independent numbers, exactly. But we will find out their identity and work with meeting with them. Sure, absolutely. We will review the care that they received, and if they have any concerns, we'll be making contact with them.
What was your feeling when you came in here and you saw everything that was going on? What did you think of that as a place to be at?
Well, you know, I came at a time of rebuilding. Mr. Young, that was here prior to my arrival, had already fixed many of the access issues, and we were caught up with that kind of work. My goal here is to move forward with a plan of action to help improve the quality of care that the veterans receive, and really help with the healing of our employees. Our employees have been devastated by what's happened to them, and we're really working on trying to rebuild with trust with them as well as our veterans. You know, all of our employees that do the scheduling process have received training, and we really have refocused that commitment for them. For whatever reason, a lot of folks didn't follow our directive in the past, and we've now fixed that. So basically, we have a clean slate with those employees. We're starting fresh, and I've personally gone out and met with all the schedulers around our system of care. I've spent time with them. I've spent an hour in their area watching them interact with veterans, watching them interact with the computer system that we have, and I'm very comfortable that they now understand how to use our scheduling directives and are properly using the electronic wait list and the near list. Well, we're still awaiting that report. They have been here at our medical center looking at the consult process for urology, and we're awaiting the results of that report. And we'll be improving that care. Whatever their findings are, we'll be improving that care as well.
Ladies and gentlemen, we have time for one more question.
Well, when I came here to this medical center, I didn't know how to handle whistleblowers. I had received training on how to properly manage the equal opportunity programs, union grievances, things of that nature. So I reached out to our experts in that area, which is our regional counsel, our attorneys. They developed a really comprehensive training package for us, and I believe that package is actually going to be used nationally to help train all executives on how to properly honor our whistleblowers. We value what they tell us, and we use their feedback to help us improve care for our veterans. So we went through training of all of our executive team, all of our service chiefs and all of our leaders in the organization, and we offered it to staff so that if they wanted to receive training on how to properly understand whistleblower legislation, that they would have that information.